Hi, welcome to my channel. This is Dr. Ravel Martinez with another video for us foreign graduate veterinarians going through the ECFVG process to get licensed here in the US. So today's video is a continuation of CPE surgery tips. The previous video I did was tips number 1, and this would be CPE surgery tip number 2. So let's get on with the tips. First step would be sweatbands. I know it sounds silly. Some surgeons know it, some people don't. But I would definitely ask for sweatbands during the exam. And the reason is, imagine several people in the same room. There's examiners, there's the examinees, there's the staff. It's people going in and out. It's hard to keep that room cold. Just like at the shelter when I was there, when we would have guests or we would have students come in, it's jam-packed. One student is doing the surgery and there's like all of the classmates are there watching their classmate. So it gets crowded and the temperature is hard to maintain. And then you also have that light right in front of your head while they're doing your surgery. So that adds to the chances of you sweating. Of course, there's always the nerves that, you're racing through time, you're trying to get everything ready. One less thing for you to worry about is your sweat dripping on top of the surgical field. Needless to say, if it touches that surgical field, there's a very big chance that it's a fatal flaw and you're gonna get kicked out just because of that. So tip number 1, the sweatband. Tip number 2, this is something that you have to study and before coming into the exam as well, would be plan B. What if the pet is already spayed? So just like in routine practice, right whenever we do the meet and greet or before we start surgery, always check if there is a spay scar. In the shelter setting, you don't know any history of the pet. Also, even in private practice, the other day I had a 4-year-old pet that was adopted from someone, just friend's friend. They're not sure if it's spayed or if it's already spayed, but they want to sign up, want to do spay for the pet. So always check if there is a spay scar, just to save the pet all that hassle, the pain that the pet has to go through. Sometimes you miss it, sometimes you see it, sometimes you may need to ask the owner, hey, I'm suspecting the pet has a spay scar. I think I can feel it. Am I able to shave the belly just to check? Hair will grow. So at least we did our due diligence to make sure that we don't subject a pet under anesthesia if it wasn't necessary. So that's tip number 2 would be always check for a spay scar. I know during the exam you'll probably see the pet right as you're doing the surgery. So while they're clipping and cleaning, make sure you're trying to feel, is there a spay scar, is there no spay scar? Sometimes it's very obvious, sometimes it's not. But what happens if you already opened up the pet? You're constantly trying to find that uterine horn. You're going in and out with that spay hook, and you still can't find it. So in the back of your head, you're like, wait a second, is the pet already spayed? So always plan for plan B. Look at where the landmarks would be if the pet was already spayed. Show them the kidney, specifically the right kidney. Show them the base of the bladder, because the base of the uterine horn typically is right by the bladder, below the bladder, above the colon, and then the ovaries will typically be right beside the right kidney, the right ovary. So plan for plan B, just in case the pet is already spayed. So the other thing too, my next tip would be, after you opened up the skin and I know sometimes there will be a bleeder, just don't dab that blood way too much. If it's bleeding a lot, get a mosquito forceps just to occlude that bleeding. But don't dab it too much, because the linea alba, I guess in English it means white line. Of course, it's white. If you dab it too much, there is a chance that you might stain it and you'll miss it. Yes, the linea alba can stain, and I've seen this in practice where a student would open up the belly, dab, 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 dab. Now they can't find the linea. So be careful not to stain the linea alba so that you know where you should be cutting. No one wants to do a paramedian just because they couldn't figure out where the linea alba is. Next tip would be, when you're trying to make that first stab incision with your blade, lift that linea, grab the linea alba with your forceps, lift it as high as possible, because right below it there might be the spleen waiting for you. No one wants to go through with that blade straight into the spleen. That's not going to be good. So lift it as high as possible. Don't be afraid. Just lift it and make sure you don't poke with that blade so deep that you're risking lacerating the spleen. The spleen is very, very vascular, so you don't want that either. So the other, right before, okay, right, let's step back. Right before you start, cutting the pet, determine, especially if you're not used to it, determine which side of the pet you need to stand on. Some people want to stand on the left, some people want to stand on the right. I typically, for myself, would stand on the right side of the pet. If it's a spay, if I'm doing a neuter, I'm on the left side. It's just how much force I need to do, if it's a scrotal that you have to. So, but that's different. Anyway, so determine which side you should be standing, which side you're comfortable for you to do the spay. Worst case is you're on the wrong side, and now it's hard for you to maneuver everything. Everything looks weird. During your practice, you were on the right side, and then for some reason or another, you were stressed and you were doing the exam when you're on the left side, and everything feels weird. So make sure you remember which side of the pet you stand, so that when you're doing that all-important spay, you're comfortable. You know what you're doing. You practiced this. You did it on this side the whole time. So that's one more tip. Okay, so I guess my time is up. We'll end this session now, and then I'll record another video for CPE Surgery Tips 3. Okay, so again, if add me up on Facebook, it's DVM Rovell, ROV as in Victor, EL, and you can always add me up. You can always send me a question or clarification if I'm saying something wrong, or if you think there's another tip that you want to add on the videos, let me know, and then we'll work on it. Okay, thank you very much, and good luck to every one of us studying to get licensed here in the US. You can do it. Thank you.